I'm Doris Yang. I'm the team leader for the self-help program and the family initiative at Hong Fook Mental Health Association. At Hong Fook, the self-help program is important to our consumers because it creates a sense of connection and belonging. Many participants, when they come here, they feel that it's like a second home. And I think this is something very important in their recovery journey, because for some of them, after getting the mental illness, they lost contact with the family members, or because they are immigrant here, their other family members are in the home country. So they see that Hong Fook seems to be like a kind of a family to them in this strange place or new place. For the past fiscal year, we have 322 participants within the self-help program. Some may come every week or even every day. Some may come only once or twice for certain outings or activities. We have 18 regular programs that may be held weekly or bi-weekly or monthly. And we also have some time-limited groups. For the long-term groups, it is like an open group and sometimes more social, recreational in nature. For short-term group, we want to focus on more specific learning. So that's why we have maybe focus on the speech skill or the self-management skills. So there are the differences. But even for the regular groups, we also have different topics. Depends on the input and feedback from the participants, what they like to learn. Sometimes on a periodical basis, we also arrange educational workshops within the group time. Actually, within the self-help program, we have both language-specific groups and also integrated groups. We see that the language-specific groups are a kind of foundation or basis for people to come in so that they feel comfortable, they can use their own language, and also connected with people within the same community. We understand that in order to feel the sense of connection, they want to do something they are familiar with. So in quite a number of our program content, they do their cultural dance or sing the cultural songs and cook the cultural food. All these attract them and they feel that it's like coming back to a very familiar place, and they have that kind of relaxed feelings and also more ready to open up. And at the same time, we also arrange some like integrated programs that we have members from different communities to join. Of course, language is a challenge, we need interpretation, but we also want to provide them an opportunity to feel how to be mixed with other people while they have their own social network, but they also have the confidence or the readiness to learn new people and new things. So yes, culture is an important area. Say, for example, for our Cambodian self-help program, the culture is everyone is within the community. So they bring in their clansmen, their family members into our group activities, especially those outings or festive events. And we don't really screen them out because mental illness is still a taboo in many of the communities. So when people first come in, they may not say, I have a mental health issues, but they are willing to come knowing that this is for people with mental health challenges. And we see examples that when they join and they have the trust, they start to review the needs and the issues, and we can refer them to other services. So we see that for this culture or this community, it should be more inclusive as a start. And then for the Korean culture, they look at authority, they really have high respect on workers and doctors. So they are not too ready to take up the leadership role in the beginning as a start. We cannot push them, say it is a self-help, you have to do everything on your own or manage, but we invite them to come in, give them the chance to work together, and with the support and encouragement, then they can gradually understand and also be more receptive to take certain leading role in the group. So it needs to also go with their flow and their comfort level. The major challenge for the program is the limited resources and space, because there are different needs from the consumers and the participants. They always say that we want more programs and more new development, but then we also need to look at the priority and how we should divide the resources fairly among different communities and also across different programs. So we need to really think through what should we invest in. The other challenge is like within the communities we are serving, maybe it's a kind of Asian culture, they are very submissive and timid, though they may have the strength and the skills, but very often when we invite them and encourage them to take up more leadership role, they may not be ready for that. They rather just to help out, to volunteer, than to be a leader in the program. But with the self-help direction, we really want to build up the consumers' involvement, so we need to work harder on that. To start a new self-help program in different places, I think it is important to look at the cultural needs and understand the readiness of the participants, because different communities, they may have different preference, and also the readiness and the comfort level in coming together as a group. So we need to listen to them and also get their input to see what will be the most effective model, so that people feel interested and also ready to come out and try.